love you like that. Taking care of yourself is the love no one else could ever give. Exercise and eating healthy, that's the best thing for your body. Smoking and drinking will not help. Sniffing and drugs, you'll hurt yourself. You gotta remember to check your blood pressure. You gotta take good care of yourself. Who's gonna love you like that? Taking care of yourself is the love no one else could ever give. Exercise and eating healthy, that's the best thing for your body.
Good evening, my viewing audience. In with this week's edition of Health Matters, I am your host, Shavini Nisbet, health educator at the Health Promotion Unit. World Health Day is a global health awareness day acknowledged and sponsored by the World Health Organization WHO and is celebrated every year on April 7th. As the theme this year was Beat Diabetes, we at the Health Promotion Unit and the Ministry of Health conducted a health screening in the Memorial Square in Charlestown. The screening consisted of blood glucose checks, blood pressure checks, and BMI calculations. Here is a look at a little of what we did.
Who's gonna love you like that? Taking care of yourself is the love no one else could ever give. Exercise and eating healthy, that's the best thing for your body. Smoking and drinking will not help. Sniffing and drugs, you'll hurt yourself. You gotta remember to check your blood pressure. You gotta take good care of yourself. Who's gonna love you like that? Taking care of yourself is the love no one else could ever give. Exercise and eating healthy, that's the best thing for your body. Who's gonna love you like that? Taking care of yourself is the love no one else could ever give. Exercise and eating healthy, that's the best thing for your body. Smoking and drinking will not help. Sniffing and drugs, you'll hurt yourself. You gotta remember to check your blood pressure. You gotta take good care of yourself. Who's gonna love you like that? Taking care of yourself is the love no one else could ever give.
We're here at the Food and Nutrition table for World Health Day, and Mrs. Vernice Blackett will tell us what she has here.
Okay, good morning, and thank you for being here. As you can see from the front of the table here, three food lists, three of the 6 different food lists that we have for the Caribbean. And these are actually the main ones. The others are important as well, but I want to stress a bit on these 3 here. I would like persons in the general public to know that there are different ways of eating. Now, we are used to eating bread, porridge, tea with milk, whether it's herbal tea or milk, Milo tea. That's what we are used to be having for breakfast. But now I'm trying to sensitize persons, everybody, especially diabetics, on the way we are supposed to be eating. Now I have here a plate with some green bananas. Instead of the bread, we can have green bananas along with our protein. I have here green bananas and sardines. It can be green bananas and egg, whatever you choose for your protein, or relish, as we call it, same as protein. And there are times when we feel like we should only eat carrots and pumpkin and so on for lunch, but we can't have them for breakfast. So this is supposed to be an example of an ideal breakfast. This one also, this is tanya, 2 slices of tanyas here, and some sweet potatoes. We have also some okras, some cauliflower, some green pepper, some cucumbers and lettuce. And on the other one, we have some tomatoes. So I would like to encourage persons out there to eat like this for breakfast. Instead of the bread, especially the diabetics, doctors are always, most of the times, telling persons to cut down or cut out the bread. You could have this. If you don't have this, you could have breadfruit. Breadfruit is most times seasonal. Well, you get breadfruit most times of the year. Um, and you always have green bananas. There are times when you might not have tanyas or yams. So some persons may say, well, since I don't have those, I'll eat some white potatoes. Well, I would like to discourage persons, diabetics especially, not to eat the white potatoes. Instead of the white potatoes, um, sweet potatoes are better. You might say, well, sweet potatoes, white potatoes, the sweet potatoes are sweet, so that will carry up my blood sugar or my calories, more quickly. But the white potatoes are actually the ones that would carry up the blood sugar more quickly than the sweet potatoes because it's more starchy. It, it, it has less fiber in the actual potato. If you're going to eat it with the skin, you would have some fiber. But most times we don't eat it with the skin, and so um, it's better to eat the sweet potatoes because the sweet potatoes have more fiber in it. If you ever realize that some sweet potatoes you have this string in it, that well, that is a form of fiber. Eh? Yes. So it's better to eat the sweet potatoes rather than the white potatoes. So cut down on the white potatoes, cut down or cut out, and eat your breadfruit and the other provisions. Now, each meal always has vegetables in it, whether it's raw or cooked vegetables. The cooked vegetables meaning the pumpkin and the carrots, and of course the raw vegetables, the sweet peppers, cucumbers, tomatoes, lettuce. Every meal should have some vegetables with it. There are good sources of minerals, meaning the calcium and the iron and so on, and the vitamins, meaning the vitamins C, A, and so on. A, B, C, D, E, F. Well, the D is actually from sunshine. But you could get all your vegetables in one go, most of the time, right? So I would like to encourage all, everybody to eat this way. Of course, you have your foods, but some diabetics are discouraged from eating foods depending on how high their blood sugar is. Some um, their blood sugar tend to fluctuate a lot if they use fruits. It's actually better to eat a fruit and drink some water rather than use fruit juice because the amount of sugar tend to be higher in the fruit juice. So drink your water and have your fruits and vegetables for your meals. Yeah, we also made provision for vegetarians. So there are some persons who say they don't eat fish and chicken and so on. You could have some lentils or some red beans or pink beans or chickpeas, cooked. And that could be your source of protein. Yes. I would also like to discourage persons from eating and drinking at the same time. We tend, that's a habit we have. And unless you're told otherwise, I guess, you don't automatically prevent yourself from drinking while you're eating. But we are supposed to chew our foods so well that the saliva, which is secreted in the mouth, softens the food enough for it to be swallowed without getting help from drink or water. So we are supposed to be eating, taking our times, chewing the food properly until it's soft enough to be swallowed. And then maybe 2 hours after is when we're supposed to be drinking, you know. You could have your drink, water. I'd say water. Let me go with water. Um, Maybe half an hour or so before. We're supposed to be drinking water so often that our bodies are well hydrated, and so our saliva is not thick, but watery enough to soften the food properly. Because when we are dehydrated, our saliva tend to be thicker than when we are well hydrated. So I would advise or encourage persons have some water throughout the day, whether it's half a cup um, every half hour or hour, depending on how hot the day is or the type of work you're doing. If you're sweating a lot, of course you need more fluid. And so by the time you are ready to eat, you don't have to be drinking. What the water does also is it waters down or it dilutes the acids in the stomach or the alkali, the enzymes that which are acid and alkaline enzymes. It waters them down so that they don't they're not concentrated enough to work on the proteins and the carbohydrates, and so the food would stay in the stomach longer. That is a different topic altogether. But I'd just like to encourage persons not to eat and drink at the same time. It's really bad for digestion and absorption.
I'm Chauvin Nisbet, Health Educator at the Health Promotion Unit, and we are here at our health fair, our health screening for World Health Day. And as the theme is beat diabetes, we've decided to keep a screening to check your blood glucose levels, your blood pressure levels, and also to calculate your BMI, which is your body mass index. And that's calculated by doing your height and your weight. Okay? So we are at the information part of the information booth, the health information. So we have pamphlets such as on self-esteem, we have pamphlets on safe sex, on drug abuse and substance abuse. We also have pamphlets on 50 things you should know about HIV and AIDS. As we are speaking about HIV and AIDS and safe sex, we also distribute free condoms at our unit. And so whenever we have an outreach program, we also have our condoms available. So we have lifestyle. We have different lifestyle. They have different colors, but it's basically the same thing. And then we have a Rough Rider, which is studded for more pleasure, because they have ridges on the side. And it's always important to remember when you're using a condom, you check the expiration date, and you do the squeeze test, so the condom is supposed to pop back after you squeeze it to ensure that there hasn't been any piercing in the packet itself, and so the condom itself is still good for use. Okay? We also have lubricant, personal lubricant, water-based lubricant. It's important to use water-based lubricant as opposed to oil-based lubricant, as oil-based lubricant can damage the condom and defeats the purpose of having safe sex in the first place. So your lubricants not only come into play if the person is not getting wet, as we like to say, but you can also use lubricant for more pleasure. So it's not always for if you're not wet, according to them. Over here, we have some educational material that is for healthy eating. So, for example, this is showing you these 3 vials here show the fat content of a cheeseburger. The 3 of them combined show how much fat is in a cheeseburger. Right? So stuff like this we have. We also have, this is how much sugar is in a 12-ounce soda. Now 12 ounces is just how much is in the can. The bottle that you see most people with would be 20 ounces, so that's not even as much. That's way more than what's in this. So that's the amount of sugar that you're taking in when you drink a bottle of soda, especially if you drink the whole bottle. And then we have the salt content, like for instance, this is how much salt is in 3 ounces of ham. And we also have cheese fries. So this vial contains 5 ounces. How much fat is in 5 ounces of cheese fries? It's a lot of fat. Right? And we also have some good ones here. Like for instance, it tells you how much fiber is in sweet potatoes. Okay? Sweet potato is a starch you can use when you're eating. So you can replace your rice with sweet potato sometimes, and it has more fiber than the rice, and it's actually healthier than the rice itself would be. Without this one. Yeah, without this one. So this is just an example of some of the things that we do when we have our outreach program, our information table, and then we also have where the actual testing is done, which would be and we're gonna go over there to check it out. And so we're approaching the health screening area. So we're gonna go from the beginning to the end. So during our screening, the first step is to do registration. At registration, you come here, you give your name, age, address, and some of your personal details, so we could have them for our data collection. After the young ladies would have recorded your information on our sheet, they give you a small paper like this. And this is for you, the same information they are recording, the same information that you get to take home for reference and for future reference.
The next step would be to get your blood pressure done. That would be the second station. A nurse would conduct your blood pressure. And then after the blood pressure is done, your blood glucose is then taken, and we use the one-step procedure to do that, where they prick your finger, just a small little prick, painless. After the blood pressure is done, the next step would be to get your blood glucose level checked. And that is done by just a simple one-step procedure. It's just a small, painless prick on your finger. They use that blood, and they check to see the level of glucose in your blood. After that, the last step would be the BMI calculations, where an individual from our unit, it could be a nurse or it could be an individual from our unit, we use your weight and your height, and we calculate your body mass index. And the body mass index lets you know if, according to your height, if you have the right body weight. And that's important in knowing how healthy you are, what you need to do to get to an healthy weight. So we do outreach programs like these because we are trying to drive awareness for non-communicable diseases, NCDs, as it is one of the highest leading causes of death in the Federation. Diseases such as diabetes, hypertension, and cancer. And so if we can do outreaches like these every couple months, we are driving awareness, and we can lower the new cases of NCDs, both in the Federation and in Nevis.
Diabetes is a metabolic disease in which the body's inability to produce any or enough insulin causes elevated levels of glucose in the blood. In type 1 diabetes, the pancreas cannot produce enough insulin because the cells in the pancreas that make the insulin have been destroyed by the body's own immune system. This insulin must be replaced. Therefore, people with type 1 diabetes must have insulin every day to live. At present, insulin can only be given by injection or by insulin pump, but other methods of getting it may be possible in the future. People with type 2 diabetes are usually insulin resistant. This means that their pancreas is making insulin, but the insulin is not working as well as it should. The pancreas responds by working harder to make more insulin. Eventually, it can't make enough to keep the glucose balance right, and blood glucose levels rise. In the year of 2015, we had in Nevis 482 registered diabetics, of which 319 were females and 163 were males. In the year of 2015, we had 21 new cases of diabetes, with 11 being female and 10 being male. And that has been this week's edition of Health Matters. I would like to encourage everyone to stay healthy by eating healthy, drinking lots of water, and exercising daily, and help us in the fight against non-communicable diseases. The fruit of the week is tamarind. Tamarind is a rich source of vitamin C and antioxidants that can help to prevent cancer. If tamarind is too sour for you to eat, make some juice from it. It makes a good juice. That has been this week's edition of Health Matters. I am your host, Chevin Nisbet, health educator at the Health Promotion Unit.
Good day. I am Curse Etienne, Director of the Pan American Health Organization. I want to call your attention to a disease that is affecting the lives and well-being of more than 60 million people in the Americas. This disease is diabetes. It affects people of all walks of life, but it takes its greatest toll on people living in vulnerable situations, those with limited resources, limited access to health care, and limited opportunities for healthy living. Type 2 diabetes, the most common form, is increasing faster than ever before and affecting younger people. This is mostly due to changing lifestyles. People in our region are consuming more energy-dense, nutrient-poor foods and sugar-sweetened beverages while being less physically active. If policies to prevent type 2 diabetes and interventions to improve diabetes control are not implemented, diabetes will affect over 100 million people in the Americas by 2040. Type 2 diabetes can largely be prevented through healthy diets based on whole, fresh foods, regular physical activity, and maintaining a healthy body weight. But it is not just a matter of people changing their lifestyles. Governments have a key role through public policies to make the healthy choice the easier choice. Good examples include bans on advertising of ultra-processed foods to children, front of package labeling for easy identification of unhealthy foods, more vegetables and fruits in school meals, increased taxes on sugar-sweetened beverages, and ensuring safe recreational spaces to encourage physical activity. For people who live with diabetes, continuous access to quality health care, including medication, is critical because uncontrolled diabetes leads to serious complications and even premature death. And that is why we are working closely with our member states to advance towards universal health access and coverage to serve the needs of all populations affected by diabetes and other health conditions. I urge you to join with us and do your part to step up and beat diabetes.
Who's gonna love you like that? Taking care of yourself is the love no one else could ever give. Exercise and eating healthy, that's the best thing for your body. Smoking and drinking will not help. Sniffing and drugs, you'll hurt yourself. You gotta remember to check your blood pressure. You gotta take good care of yourself. Who's gonna love you like that? Taking care of yourself is the love no one else could ever give. Exercise and eating healthy, that's the best thing for your body.